I can't say enough. I've been so happy with this. I even talk to other CIOs, other CEOs of other health centers and tell them, you need to move to HealthTalk. My name is Eric Rios. I'm the Chief Information Officer from Spectrum Health Services out of Philadelphia. One of the major issues that we ran as a health center by reaching out to our patients was that we generally didn't see a good response when it came to their telephone calls. Patients don't answer their calls. For them not to be able to answer those calls, we can't treat the patient in full. Spectrum Health is their PCP. If they're not coming in to see their PCP, they're going to go to their ER for their PCP visit. And that visit alone, as we know today, costs much more than walking into a health center like Spectrum. They presented us a good demo of how reaching out to a patient via text gives the ability for the patients to now control them coming in, them deciding what date works for them, what location and time, given the access and the ability back to the patient, giving them that ownership versus having them to sit back and call a call center, wait. So when we saw that demo, it really caught me right from the beginning. It sold me because of that easeability for our patients to be able to reach us better. We're a nonprofit, right? We don't have deep pockets. We can't spend tons of money building an application with bot responses that we just can't afford to do. Where HealthTalk was able to come in, be able to say, hey, you guys are, community health centers, you don't have your deep pockets. Let me help you get the technology you need to take care of your patient. HealthTalk was able to come in. They did a full presentation for us, did actual demos. We saw the reactions on the phones. We saw it real time. By seeing real-time scenarios really helped our senior leadership understand how it works. We meet weekly with HealthTalk. We go over a lot of scenarios. We talk about what it is that we're trying to do and how can HealthTalk get us to that location. So we literally go through scenarios. We do testing. We beat the system to the point where it actually meets the needs of the patient. One of the points that I've drawn out was the issue of getting patients to come in for their care gaps. So by building out a demo as to, hello, Eric Rios, you're scheduled to come in, or we have not seen you for your X so-and-so screening. Would you like to now schedule an appointment? Patient says yes. Oh, here's the location. I want to go to that location. And the time I can pick, oh, those times don't work. Here comes the next set of 3 that comes up, giving that patient multiple opportunities and choices for them to select, for them to come in. So by showing this and seeing the results, automatically was one of the biggest draws for us. One of the big things, we just most recently did a cervical cancer screening. We had 1,400 patients who needed to come in for their screening. And most of the responses that come back, if we get a good 10% response, that's astronomical. We would never get that through a telephone call. This cervical cancer screening gave us over 20% response. We had 66 appointments. All 66 were filled. And because our interface with our EHR, it automatically puts the appointment in the schedule. So 66 appointments filled up instantly within 2 hours, and another 287 patients wanted to schedule appointments, but we didn't have any more slots. It was such an astronomical response, and it gives me chills just even talking about it, because patients want to come in. Now, instead of them not even calling us, now we're reaching out to them because we're being proactive. We're trying to help them get better. So it's been amazing. A positive thing that we want to be able to do is allow the patient to go to our website and schedule their own appointment themselves. So we have what's called a digital front door where the patient can go in, hey, I'm sick. I can go ahead and, get on the spot, say it's a sick visit. I want to go to one of our locations. Here's the time I'm coming in today. Patients have made comments on our customer service surveys to tell us, before we didn't know about whether it's particular events, whether there are particular things that we need to come in and be seen for. We just had to make the appointment. Patient had to make the appointment and say, all right, let me do this. Now that we can push this data out, we have the data that tells us these are your patients that need to be seen for this. Let's reach out to those particular patients and let them know. Patients have given us incredible customer service satisfaction results from it. We're seeing such a high number. Our NPS is always above 90% because patients are now being contacted, and really we're seeing that we are telling them that we care and we care, we serve as part of our mission. So now let's let technology help us reach out to the patient and help them. One of the folks that work with us every week, every Wednesday morning in our meeting is a gentleman that had worked in an FQHC previously. So he has the experience and understands what we feel on an everyday basis. Now, for him to better understand it, we can easily have those conversations. He understands what it is that I'm trying to do to help the patient, get them in the door. So having someone from HealthTalk on their side to understand what we go through is huge. Who better to know about FQHCs than someone who's worked for them before? So that's a big deal. We're now even stretching it to even things that they've never even done before. So to have HealthTalk be able to be open to these type of things, hey, I didn't even think about that. So we're teaching each other, and that's why I love so much that everybody on that team is just so open to just any sort of suggestion. A lot of vendors today don't do stuff like that. Kelly's been phenomenal. I mean, to have that experience again, and who's someone who's been in the field, means more to me than anything, because he can speak my speak. Jared's been phenomenal. He's been very integral in this whole entire process during the contract phase, during the implementation, and even today, we still contact with each other. I talk about all the great things that we're doing with HealthTalk. Days of doing older phone calls or reaching out or sending letters is gone. Today we have to embrace technology. We all need to be technologists in health and see how the technology can help us get the patients back in the door. So embrace it. And again, with HealthTalk and how it relates with technology and how it's all intertwined with AI, bot technology, it has always been, and it has been, and there's nothing better today than how we are getting out to the patient to get them back in our door. I can't say enough. I've been so happy with this. I even talk to other CIOs, other CEOs of other health centers and tell them, you need to move to HealthTalk. And I'm not just saying that. They have been the greatest thing for us and has been a game changer altogether.